Hello, I'm Woodrow Wilcox. Thank you for visiting my website, citizenwoodrow.tv. Today I'm going to explain to you just a few of the problems with the current Medicare medical billing system. These will be just some of the problems that cause wrongful medical bills to be sent to senior citizens on Medicare. This will just be part of a lecture that I used to give in our community to explain what I do to help clients of the insurance agency where I work. My work to help our clients is done free of charge as a value-added service to our clients. First, take a good look at the chart that I used to explain the Medicare system. I made this chart. Realize that communication systems that the Medicare system uses are made up of parts of telephone lines, satellite connections, and internet connections. All these communication systems break down at times. I believe that they break down multiple times per day because of bad weather, sunspots, equipment failures, human error, and other related reasons. When the connection is broken, even for part of a second, data is lost. When the data gets lost, one or more senior citizens are likely to get wrongful medical bills. If they don't have anyone to help them fix it, they are hounded to pay the wrongful medical bills. I've helped many senior citizens fight the wrongful medical bills to save money, but the Medicare system should be fixed so that fewer wrongful bills are generated. Because of my experience with bad medical bills caused by shortcomings in the Medicare system, I believe that the Medicare system needs serious changes to avoid financial harm to senior citizens. Now let's start to explain basic Medicare medical billing problems and correction methods. These will be some of the basics of what I have done for over 22 years. First of all, a hospital, doctor, laboratory, or other medical service provider gets a client and serves them. Then they send the information to Medicare by telephone lines and satellite and internet connections to the Medicare contractors or U.S. government that are going to help determine what part of this bill will be accepted, what discount will be given because it's a Medicare claim, and what the balance will be, the last 20%, which either the client or his Medicare supplement insurance company will pay. Then Medicare, the contractors of the U.S. government, send the Medicare EOB, which is explanation of benefits, through the communication system. I'm pointing to the satellite just to represent the whole communication system. And that goes down to the insurance company and to the senior citizen. It also goes back to the hospital, doctor, laboratory, or other medical service provider. So you've got an internet connection being sent from the doctor, hospital, or laboratory, or other medical service provider up to Medicare, then a determination by Medicare back up through the communication system, and doctors, hospitals, and laboratories get what they refer to as a Medicare EOB, explanation of benefits. The insurance company gets a similar item, explanation of benefits, with the calculation of what the insurance company that has the Medicare supplement insurance policy for the client, what that insurance company expected to pay to the doctor, hospital, laboratory, or other medical service provider. But Medicare also sends by mail to the senior citizen what's called a Medicare summary notice. A Medicare summary notice gives the explanation of how much was charged by the doctor, hospital, or laboratory, what Medicare figured was the correct amount that should be paid by Medicare, 80%, and by the insurance company, 20%. But it gives this report to the senior citizen. Now, if there is a problem and the communication is not connected, often, I'll tell you what happens usually, Medicare goes ahead and sends the information to the hospital, doctor, or laboratory and to the insurance company. But for some reason, if there's a break in communications, the insurance company won't get the claim, the report by Medicare, or the doctor or hospital will not get it. They'll refile and get another claim. And so there's ways that the whole communication system can be loused up. But this item, the Medicare summary notice that's sent to the senior citizen, I can look at that and compare it to the bill that is generated by the hospital, doctor, or laboratory, compare those two things. And if the insurance company has got the claim and sends an explanation of benefits from the insurance company, I compare those three things together. And if there's a problem, I'll find it. And let me tell you what happens. This is the system of the Medicare plus Medicare supplement system. Medicare Advantage works an entirely different way. And as a matter of fact, if you're thinking about going on Medicare Advantage, I would caution, if you go to the hospital a lot, Medicare Advantage is probably not the thing you want. I'm not a licensed insurance agency, but my experience of helping senior citizens and my experience of the insurance agency talking to the insurance agents lead me to believe that if you're not in good health, you probably need to stick with the Medicare plus Medicare supplement system, okay? So take that with, if somebody cautions you or says, try this Medicare Advantage system, you have to realize there are a lot of ifs, ands, or buts in that. I had one client that I helped straighten out a medical bill when he was under a Medicare supplement system. And I always helped him straighten out bills. But then he tried a Medicare Advantage system. He went to the hospital for minor surgery and ended up with $6,000 of bills. And he asked me for help. And I said, I'm sorry, you've fallen out of this system and gone into another system. The Medicare Advantage system has a whole new set of rules. And I just can't help you. He was very gracious, very nice. He used to own a Greek restaurant. He's a Greek gentleman. He invited me to his home for Easter. It was a lovely time. He didn't blame me at all. I just said, I can't help you when you went to Medicare Advantage because there are different rules. And this is the system that I have been helping people with, and this is one I'm most familiar with and can still help people with. Now, take a few weeks ago, actually several months ago, and I talked about it in another video. If you look for the video, saved client over $400,000. Let me explain to you what happened with that widow whose husband died, and over a year later, after he had passed away and she had buried him, she started getting medical bills. She got almost $400,000 of bills for his stay in the hospital and the various services he got. And that was from the hospital. She got over $40,000 of bills that were from contractors like anesthesiologists or something like that. Here's the problem. The two bills that were not from the hospital were generated because of a very common problem with Medicare. I told you that the communications between Medicare and doctors or hospitals and the insurance company sometimes breaks down. Here's what happened. With those two minor bills that total over $40,000, Medicare had ruled for the medical service providers that they were owed something, but the insurance company didn't get the claim. And so it was a very common mistake. That problem I was able to help straighten out by simply getting a copy of the medical summary notice of the senior citizen to the hospital, doctor, laboratory, or it's otherwise saying, no, look, you got the Medicare EOB from Medicare. I want you to send the original billing information about your claim with the Medicare EOB that you got. There's another term for it too, but I can't remember that right now, directly to the insurance company. Once the insurance company gets those two things, it will go ahead and pay you the claim because it's a contract for a Medicare supplement. And whatever Medicare says is covered, but doesn't want to pay the last 20%, the Medicare supplement insurance company is supposed to do that. Otherwise, it falls on the patient. So the widow was getting over $40,000 of bills, which I could easily show Medicare had ruled on these. The doctor, hospital, or laboratory had the ruling, but the insurance company did not get the ruling. Somehow the communication system broke down, and now the widow was being faced with over $40,000 of bills that Medicare had already ruled the insurance company owed, but the insurance company didn't get the information, and you can't blame an insurance company for not paying a claim if it never gets the information. I'll tell you what, this happens a lot. This happens a lot. This kept me busy for 22 years. Just that problem. It keeps happening. So anyway, I very easily cleared up over $40,000 of bills, but there was another problem, and that is the hospital that the husband had been served at when he passed away never got around to filing with Medicare, filing the claims, and they had 1 year to file it. So the hospital was sloppy in its bookkeeping and did not do anything the correct way. It passed up the deadline, never filed with Medicare, and now the hospital is using 2 billing companies to bill the senior citizen widow almost $400,000. Well, I got the help of the Indiana Attorney General and the Indiana Department of Insurance, and basically they told the hospital, hey, you didn't file with Medicare on time. You don't get any money. You have to eat these bills. So let me tell you, the problem is with that was that the hospital had closed its offices in Indiana and moved to another state where its headquarters was. It turned over similar bills to different medical billing firms. So the widow was getting over $40,000 of bills that I could easily show. The problem was just that the insurance company did not get the information. And once we got the information at the insurance company, over $40,000 of bills went away. On this one, the hospital acted with ill malice, with ill will. They billed the widow for the services to the deceased husband directly, which they can't do. Their contract with Medicare, they have to file the claim with Medicare. They don't file the claim with Medicare on time, the bill goes away. So I was able to get the bill, almost $400,000, wiped away for the widow. So I saved the widow over $400,000 and almost $40,000, just because I knew what the Medicare system should do and what the rules were. And I basically got hold of different people to help me tell the hospital, hey, stop billing this widow. You're not following the law. You're not following Medicare law. So straighten out. If you learn this system and want to help senior citizens to get rid of these bad bills that they get, I suggest that you go to other videos on my website and also go to the articles. See what kind of letters I write to the medical service providers and the insurance companies to get their help to straighten out the medical bills to save senior citizens from wrongful medical bills. You know, the hospital in this case was really, really bad because think of it. If a woman over 75 years old gets some bills that total over $440,000 because of the death of her husband, which she buried over a year ago, isn't that possible that you could cause that senior citizen to have a heart attack from getting those bills? And, you know, I'm in Northwest Indiana. I've helped a lot of people. I've saved people over $3 million. And I think this problem is happening all over the United States. And I haven't gotten one politician to listen to me to try to help straighten it out. So I'm trying to find politicians that really care about the senior citizens. And that's why I built this website. And that's why I'm pursuing this to help people know what is going on, because it's not just happening in Northwest Indiana. It's happening all over the country. Okay? And I'd like other people to help the senior citizens in their area to fight these kind of bad medical billing. I'm Woodrow Wilcox. Thank you for watching.